newborn, presented with hypoxic respiratory failure, a gone string appearance. Cardiography done suggested the features of transposition of great vessels. Kindly demonstrate echo features of transposition of great arteries on parasternal long axis view.
This is how to keep the probe for parasternal long axis plane. Can you see this second to third intercostal space? And the marker is a second intercostal space parallel to the sternum on the left side, with the marker facing to the right shoulder joint. And now I'll show you. Parasternal long axis. Normally, what should happen? What you see here is left atrium, and this is the mitral valve, left ventricle, aortic valve, and then aorta goes straight. That's what we see normally. But here, in this transposition of great vessels, what's happening? Left atrium, mitral valve, left ventricle, and this valve is belong to the pulmonary artery. And then you can see this pulmonary artery, the aorta, instead of going straight, here the pulmonary, because there is pulmonary artery attached to the left ventricle, it's going down. You can see the branches. This is a right pulmonary artery, and that is a left pulmonary artery. Can you see? This is the, on grayscale, 2D echo, and this is a moving image. You can appreciate left ventricle is attached to the pulmonary artery. How do we know it is pulmonary artery? The pulmonary artery is branched. It is showing right and left branches. Are you okay? Color Doppler, you can see what you can see. This is the left atrium, left ventricle, and then pulmonary artery. You can see the two branches. One branch here, the other branch is here, and there is a ductus arteriosus. And you see this right ventricle. Right ventricle, the right vessel. So that means right ventricle is attached to aorta, and the left ventricle is attached to the pulmonary artery. So this is what you can demonstrate on parasternal long axis, both on color Doppler and 2D echo. Are you clear?
Yes, sir. Demonstrate the echo features of transposition of great vessels on parasternal short axis view.
For parasternal long axis, you have to keep the probe on second or third intercostal space on the left side parallel to the sternum and with the marker facing to the left. Now I rotate this, see, 90 degrees in such a way that the probe marker is facing the left shoulder joint. Now, what are the features? View. Can you see that? This is usually, normally, aorta will be here, the pulmonary artery will be here. Correct? What's happening? The pulmonary artery, when it comes from the right ventricle, it should branch. But you see, it is going straight. Can you see that? It's going straight. Aorta, which should not branch, is branching. That means, normally this is aorta and this is pulmonary artery. But in transposition of great vessels, this would be the pulmonary artery with the branches. You can see the branches here, the right branch and left branch, and you can see this right ventricle opening into the aorta directly. So now you understood that?
Yes.
So that means what you see periphery is your aorta connected to the right ventricle. And what you see here is your pulmonary artery, because you can see the branches. This is on short axis plane, and it is a grayscale moving image. I will also demonstrate short axis plane. This is a color Doppler. One can see this is the aorta straight, which is connected to the right ventricle. And I told you that normally you will find aorta here, but aorta is here, and the pulmonary artery is branched here. So you can see right pulmonary artery and the left pulmonary artery. You can see the ductus arteriosus also attached. So this is on color Doppler, the transposition of great vessels on short axis plane.
Echo features of transposition of great vessels on 5-chamber view.
How to keep the probe? First, you should. This is called as the 4-chamber plane, where you can keep. See, the, this is the 4. This is also called as apical plane. So in this, the 4-chamber view first you take and tilt it. See, when I tilt, the 5-chamber is 0. What is the difference between 4-chamber view and 5-chamber view? 4-chamber view is right ventricle, right atrium, left ventricle. In 5-chamber view, in addition to those 4 chambers, you have aorta. That means left ventricle opening to the aorta. You can see here. You have got right atrium, right ventricle, and then you have got left ventricle and left atrium. Now, this left ventricle is open to, normally left ventricle is open to aorta. But you can see left ventricle is open to pulmonary artery. You can see the branches of pulmonary artery here. One branch here, one branch here. So this is what you see on the grayscale moving image, apical 5-chamber view, transposition, great vessels. Now, the Doppler 5-chamber view, you can appreciate the left ventricle. This is the flow and it is branching. You can see the branching here. So that means on color Doppler, this flow is getting branched. That means left ventricle is connected to the pulmonary artery. So this is a moving image on color Doppler to diagnose transposition of great vessels.